Your head is throbbing. The wound on your arm is swelling. You have no hospital, no pharmacy, no doctor you can call. What you have is the forest, the river, the knowledge your grandmother passed down before she died, and a set of tools so strange, so counterintuitive, so deeply uncomfortable to modern eyes that most people assume they couldn't possibly have worked. Most of them did. For the vast majority of human history, roughly 300,000 years of Homo sapiens walking this planet, your ancestors healed themselves without a single synthetic compound. No aspirin, no antibiotics, no sterile surgical theater. And yet they survived infections, set broken bones, managed chronic pain, and in some documented cases, performed brain surgery. That last one deserves a second look. Somewhere around 7,000 years ago, a surgeon, and that word is not used loosely, took a stone tool and cut a hole into a living person's skull. Not a small hole. A deliberate, carefully shaped circular opening through solid bone, exposing the brain beneath. The procedure is called trepanation, from the Greek trepanon, meaning borer. It is the oldest surgical procedure in documented human history, found on every inhabited continent, and performed without anesthesia as we understand it. Here is the part that should stop you cold. Many patients survived. Research published in 2018 by Kushner, Verano, and Teitelbaum in World Neurosurgery examined hundreds of trepan skulls from prehistoric Peru. What they found was bone regrowth around the edges of the holes. That regrowth only happens in a living person. It takes weeks, sometimes months. These patients didn't just survive the surgery. They recovered. They went on living, with a hole in their head. Why would anyone drill into a skull? The honest answer is that we don't know for certain. Researchers have proposed several theories: relieving pressure after a head injury, treating seizures, releasing what ancient people believed were evil spirits causing illness. What is not in doubt is the technique. The cuts are too precise, too consistent, too anatomically aware to be accidental. Someone knew what they were doing, and they were learning. Kushner's study found that survival rates in prehistoric Peru improved over time, from around 40% in early examples to nearly 80% in later periods. That is a learning curve. That is iterative medicine. But skull drilling is only the beginning. Walk back further, into the camps of hunter-gatherers somewhere on the grasslands of what is now Europe or the Middle East. Your ancestor has a toothache. Not a modern dentist office toothache. A deep, pulsing, sleep-destroying throb that has lasted 3 days. Pain management, in that world, was not optional. It was survival. A person disabled by pain cannot hunt, cannot gather, cannot protect the group. So what did they reach for? Willow bark. The inner bark of the white willow tree contains a compound called salicin. When metabolized by the human body, salicin converts into salicylic acid, the active molecule later synthesized in modified form into aspirin. Aspirin was not invented in 1897 by a chemist at Bayer. It was discovered, worked out empirically over thousands of years, by people who noticed that chewing willow bark made the pain quieter. Daniel Mowerman's extensive cataloging of Native American medicinal plant use, published in 2009, documented willow bark as a pain treatment across dozens of independent cultures who had never contacted each other. That convergence is not coincidence. That is empirical pharmacology, conducted without laboratories, replicated across continents over millennia. Your ancestors were running experiments. They just didn't call them that. Now consider the wound on your arm. It has been 2 days. The edges are red. The skin around it is warm. In the modern world, you would get antibiotics. In the world your ancestors lived in, you would get something that sounds, at first, completely wrong. Honey. Raw, unprocessed honey has demonstrable antibacterial properties. Research by Mundell and Mundell, published in the Asian Pacific Journal of Tropical Biomedicine in 2011, confirmed what ancient Egyptian physicians had documented more than 4,500 years ago. The Ebers Papyrus, one of the oldest surviving medical texts, compiled around 1550 BCE and analyzed in depth by scholar John Nunn, lists honey as a wound treatment in hundreds of recorded remedies. The ancient Egyptians were not being poetic. Honey produces hydrogen peroxide when it contacts wound fluid. It creates an acidic environment hostile to bacteria. It draws moisture out of bacterial cells through osmotic pressure. They didn't know any of that. They knew that wounds packed with honey healed faster and smelled better. That was enough. But honey was not the strangest thing they reached for. Somewhere in ancient Egypt or in medieval Serbia or in the mountains of the Andes, someone noticed that bread left to mold, old green-gray, furred with fungus, had an unusual effect on festering wounds. Applied directly to the infection, the moldy bread seemed to slow the rot, sometimes stop it entirely. Historical records from ancient Egypt, Greece, and Serbia all document this practice, as traced by researcher R.D. Forrest in a 1982 study published in the Journal of the Royal Society of Medicine. The reason, as Alexander Fleming would demonstrate in 1928, is that the mold, penicillium, produces a compound that kills bacteria. Penicillin. Your ancestors were prescribing penicillin thousands of years before anyone understood why it worked. The bread was just the delivery mechanism. There is a figure who brings all of this into focus. His name is Ötzi, and he died in the Alps approximately 5,300 years ago, preserved in a glacier until 1991 when hikers stumbled across his frozen body. Ötzi is the most thoroughly studied ancient human in history, and among the items found with him were 2 small pieces of birch polypore fungus, tied to a leather cord and carried like a pouch. Murphy and colleagues, in a 2003 paper published in Radiology, documented these findings. Birch polypore has known antimicrobial and antiparasitic properties. Ötzi also had a significant whipworm infection in his intestines. He was not carrying those fungi as decoration. He was carrying them as medicine. Ötzi had a medical kit. He had a diagnosis. And he had a treatment. Now consider something even more unsettling. There is a cave in northern Iraq called Shanidar. Inside it, a Neanderthal was buried roughly 60,000 years ago. Around the body, researchers found concentrated clusters of pollen from at least 8 plant species, including yarrow, groundsel, and ephedra. Many of these plants have documented medicinal properties. Ralph Seletsky, reporting in Science in 1975, suggested the Neanderthal had been buried with flowers, perhaps deliberately placed by those who mourned. The interpretation is debated. A later reevaluation by J.D. Sommer in 1999 argued the pollen may have been introduced by burrowing rodents or natural deposition. The scientific community has not reached consensus. But here is what is not debated. Neanderthals lived for hundreds of thousands of years in harsh environments. They had to know their plants. They had to know what to eat, what to avoid, and what helped when the body failed. Whether or not the Shanidar flowers were placed with intention, the knowledge was there. Now for the one that requires the most courage to sit with. Maggots. In wounds that had become deeply infected, necrotic, gangrenous, rotting from the inside, ancient healers in Maya civilization, among Aboriginal Australians, and in Renaissance Europe placed the larvae of certain fly species directly into the wound. Sherman, Hall, and Thomas documented this practice across cultures in a comprehensive review published in the Annual Review of Entomology in 2000. The maggots they found consume only dead and infected tissue. They do not touch healthy flesh. They secrete compounds that kill bacteria. And they physically debride clean, the wound in ways that even skilled surgeons find difficult to replicate. Modern medicine rediscovered maggot therapy in the 1990s. It is now used in hospitals across the world for wounds resistant to antibiotics. Your ancestors got there first. What all of this points to is something uncomfortable for a modern mind trained to see progress as a straight upward line. The image of ancient people as fumbling, superstitious, helplessly vulnerable to disease is not quite right. They were empiricists. They watched. They tested. They remembered what worked and passed it forward. Willow bark for pain. Honey for wounds. Moldy bread for infection. Fungi for parasites. Careful surgery on the skull. They did not have the language of biochemistry. They did not need it. They had something arguably harder to maintain: patience, observation, and a willingness to try again. The next time you swallow an aspirin, you are at the end of a very long chain of human curiosity. Someone, standing barefoot in a forest thousands of years ago, chewed on a piece of bark and noticed that the throbbing in their head grew quieter. They remembered. And because they remembered, you are here.